Hello, I'm Hugh Tilson, an ASTHO alumnus from North Carolina, here for the De Beaumont Foundation-funded Indiana University Fairbanks School of Public Health, ASTHO-supported project on public health leadership for state health officers. I have the privilege of talking with, this is really fun, isn't it? I have the privilege of talking with you, Nicole Alexander Scott. Thank you so much for joining us for this discussion.
Thank you for inviting me. I'm glad to be here.
Well, let's just start at the very beginning. This is about how can we help state health officers be successful. So what's your definition of success? What's success in public health for a state health officer?
For a state health official, in my view, success means that you're able to bring some of your own skill sets, talents, gifts, and abilities to a state public health agency, be able to embed with and add to the expertise that already exists there, and advance that agency to another level prior to leaving. So, for example, from my perspective, our agency had a real focus on health equity. And my entire career has involved a commitment to eliminating disparities and achieving health equity and making sure that there is equitable access to services and care for people. So bringing those together has been a signature goal for me, to be able to make sure that our health equity zones initiative that the department had already birthed, that I was able to join with and take to the next level, and promoting it at the state level is successful. We want it to be successful. We want it to be sustained. And for me, one of the demonstrations of success will be that by the time I leave, the Health Equity Zones Initiative is not only successful, but institutionalized and well embedded into our state system with sustainable funding for making the difference that it's intended to going forward.
Don't misunderstand this long pause as anything except I want to be sure that that gets its own independent time on camera. That was a wonderful answer. Think out loud with us about the ingredients of success. You've named your one great success, one key area of success. What are the components of that? What are the key attributes that of your own personal attributes and other aspects that you bring to making that a success?
From the state health officials' standpoint, personally, what that person brings to leading to such success as an outcome really revolves around emotional intelligence. It's interesting how prominent that has become during my time here. It's something that I was always aware of and certainly appreciated having some experience with, but really have acknowledged that key element to engaging with partners, being able to communicate to your governor, to other legislators, as well as to fellow colleagues and directors of other state agencies, and to your staff in a way that promotes and inspires leadership. Emotional intelligence is something that should not be underestimated. Being able to be self-reflective, understand why you're having certain reactions to certain responses or activities that are going on, and being able to follow with and be responsive to what your agency is saying is needed. The ability to value who has been there in your agency, who's been committed to public health, and to build on that with that element of emotional intelligence, for me, is a key strategy in achieving the success that's needed. It's oftentimes more than actual knowledge about public health. That's certainly a key component. Being, quadruple board certified adult and peds infectious disease, I'm familiar with the knowledge benefit, but it oftentimes comes down to being able to be in tune with the people around you, sensing what needs to be moved forward, how you can be that strategic health officer and really get your agency to be in a better place by the time your tenure is over.
Let me segue to challenges. In addition to this leadership achievement, what is the greatest challenge that you faced beyond that? Other things that so far that have got big and taken a lot of your time. What would you name as the biggest challenge?
Number one, by far, is human resources and being able to understand what management skills are also important to have while focusing on being a leader, understanding how to delegate as well, and understanding how to motivate your staff, to incentivize those that are doing good and to hold accountable those that are not, all within a variety of political environments that exists, whether labor relations or a more conservative environment or more liberal, navigating all of that with a human resources system that sometimes has been overlooked over the years because it's easy to eliminate or not invest in when, money gets tight, has been one of the bigger challenges that has required the steepest learning curve and has oftentimes pushed me in terms of that emotional intelligence and being able to better assess, all right, so what's needed in this situation to navigate this barrier? How do we find the best in people to get the outcomes that we want?
I love the way you laid that out. And you've already talked a bit about this, but I'd like you to think out loud a little bit more about leadership lessons you've learned as you've tried to master HR. It takes leadership.
Yes.
So what are the leadership lessons?
Yeah, and those leadership lessons, for me, connect to what I've mentioned about being in tune with the people around you. So being able to gather the information needed to make a decision expediently, not taking forever to do it, but making sure that you have enough information to make a decision. Feeling confident then to be decisive about a decision. And then also have the ability to be humble if there's a need to learn from the good or the not so good about that decision and make sure it doesn't happen again. So that continuous cycle, takes energy, as a leader to be effective. And there's always that balance of figuring out how to stay attuned to what's going on around you from the emotional intelligence standpoint, but then to also not be paralyzed by that and move forward in making a decision. And you just have to go forth in that, be confident in your own experiences and decision making, and then be confident in a team around you that believes in you and can provide feedback and input that will help make the agency successful overall.
And if that weren't enough, you had a lot of experience with the State Health Department before you came to work there as the director. But nonetheless, it's different being the director. Was there something you wish you had known on the first day that you didn't, that came as a surprise when you became director? What do you wish you'd known? My
biggest surprise probably was the amount of legal involvement in your everyday activities. If you would let me, I could have my chief legal in almost every meeting. He might not appreciate that, but there's always an opportunity to sort of view your risks and benefits. That was more than I had understood the case to be. So it really highlighted for me the importance of having your strong operations team around you, making sure that you have people that you are confident in and who are competent and also have a similar heart and vision as you. So your chief legal counsel for sure, your chief financial officer, your communications director, your legislative liaison, and then your number 2 person in command as well, whether they're referred to as a deputy or chief of staff or COO. That's a core team, and everyone will have a few differences here or there, but making sure that you have not only those people that you're confident in, but also the group who you can close the door and they can also tell you the truth about a decision that's made and what the best decision may be in a way that you can appreciate and trust that in moving forward.
Yeah, I love truth telling. I'm so glad you brought that out. In fact, I think you mentioned integrity in your survey, and that's so important. If you wanted to actually use a sentence that used the word integrity, it wouldn't bother me. Just think out loud about integrity and what that means for a state health officer.
Integrity as a state health officer, for me, it's a stabilizer because there's so many moving parts that can occur, so many conversations that you're having in one room and then going to the other room and having a different angle of that same conversation because of who you're speaking to. So having that element that grounds you in knowing that your heart and intentions are in the right place to do the right thing to the best of your ability in a way that reflects the integrity that you want to exude helps kind of rebalance and reground me. I do tend to lean towards that because it can become easy to get swayed, in your conversation with the governor's office today and then with the legislator tomorrow, but with, an advocate from the community the day after that. What's the central value and core that is driving you to be able to make the decisions and have the conversations you need to with each of those audience members, but in a way that still fulfills the integrity that you always want to maintain.
Breathtaking, thank you. One of the things we're studying is the high turnover among state health officers. What is the impact of having a state health officer leave?
It's significant.
Would you start that again? Just sort of, what is the impact? Tell me about the impact of a state health officer leaving.
The impact of a state officer leaving is significant on an agency. I oftentimes think of the leaders within the agency at the program level that have been committed for years. And prior to starting and prior to my name even being placed in the hat, so to speak, one of those leaders shared with me, we respect who is in that role, but at the end of the day as well, we are the ones who kind of keep the machine going and are critical to be responsive to the different needs of the community. So it's key for state health officer to recognize that when they're in their position, number one, so that there can continue to be an investment in those people who have been committed 5, 10, 15 years to doing the right thing so that they can have the leadership development and career development and support that's needed. But then it's also more stabilizing for the agency to not have the change. Human nature, someone new comes in, there's a need to shift or change something. Sometimes you're changing priorities and directions altogether because it's also within a new administration. That's disruptive for an agency if it happens too frequently and can hinder the ability of a public health agency in particular to positively impact the community the way we all intend to do. So having that time to really advance what's needed, institutionalize some of the core values that are key, add some tools that will lead to sustainable funding over time. Those are goals for me to be able to establish while in the agency. If I leave too soon, that kind of just goes astray, unless, the next person comes in with it even better, which is always a good thing too.
You always hope, don't you?
Yes.
You brought up, and I want you to just think out loud with us about it, the relationship between academia and public health, particularly for a state health officer. How does a state health officer build relationships with schools of public health or medicine in the community?
So I can tell you how important I feel the relationship between academia and public health is by sharing that on day one of being a state health officer in Rhode Island, I presented to our all employees staff at our first meeting the creation of the Rhode Island Department of Health Academic Center. And I shared with them that what my vision is for this academic center is to be able to integrate what I had enjoyed doing in the 2 full-time jobs that I had just before being selected or appointed by the governor into this role, which was as a clinical academician. I would see in the academic world new advances, research, latest clinical trials, innovative thought processes with students who are constantly engaged and asking questions. And then I would see in the public health world rich statewide level data, connections to the community, and seeing the full extent of the needs at that level and the ability to intervene. So for implementation science, so to speak, at the community level. When you can bring those 2 worlds together, the synergies that result have been, monumental. When you see what San Francisco within the HIV world, for example, has achieved in having the university embedded with the health department there. And that was really the motivator for me. So we're now 2.5 years in with having the Rhode Island Department of Health Academic Center. We have a focus on promoting workforce and career development for our staff so that they can be engaged in the academic process and really stimulate the research questions that we have. Why are the overdose rates as high as they are in this community? Why isn't this community using the SNAP benefits that we have for them? What can we do better about the teen pregnancy rates in this community? And use those questions to lead the partnership with academia to say, your research career is focused on overdose. Let's partner. Help us in answering these questions. And then that can just not only foster innovation, but solutions. Together, then, we can apply for grants and diversify our funding portfolio, which they hear me discuss often, and then bring students through who can get exposed to an entire new world of public health. Not only health students, but economists and architects and paralegal and other professional students who can then see what it is to achieve health equity from a public health perspective.
So let's segue to the future. Public health is an extraordinary field, and you obviously love what you do. What do you think the most exciting, greatest opportunity is ahead for us in public health, particularly in state public health leadership?
The most exciting opportunity I see for state public health leadership is to really take the role of being a convener to the next level. In order for us to really achieve the ability to say, regardless of the zip code you're from, you should have access to living the healthiest life you can live in the healthiest community. It's not going to happen just through a narrow public health lane. It has to happen with our transportation and our policy and education and child welfare and behavioral health partners together, understanding that mindset. And oftentimes they are doing that in their respective worlds, but need public health to be able to translate and bring together those languages so that instead of going off in silos, potentially in two different directions, we can align the paths and the directions that we're going in and help leverage the work that needs to get done. It's a deliberate process, and it has to happen at the local, state, and federal level. And as state health officials, we have the ability to directly impact both as well as our own level. The number of times that we talk to our federal partners about thinking proactively of how they can align the grants that SAMHSA is giving us for overdose with the grants that CDC is giving us for overdose, so that we can better leverage the work that we all need to do to address the overdose epidemic. And then at the local level, how can we share best practices among the various communities to help each of them get up to an equal level of achieving the optimal health outcomes that we know are necessary. So if state health leadership can continue to really be focused on that ability to bring together the usual partners as well as the unusual partners, enjoying connecting better with our Commerce Secretary in our state, those types of connections can really take us to where we need to be to achieve health equity, which is our goal from a public health perspective.
Great, almost last comment. For your last one, think out loud what do you want to say to the next generation of public health leaders? I mean, here you have people looking who are students or new state health officers. What do they need to know?
For the next generation of public health leaders, my message would be certainly follow your heart. Do what you are passionate about. It's absolutely what has led me to this role. But then also think outside the box. Don't consider yourself to be the only one that's thinking that, or start from scratch, but look around you to see how you can leverage the partners who are there. Because being effective within public health, the one thing it requires is for you to not do it by yourself. So the ability to know how to engage partners, how to speak the language that they speak so that we can get the outcomes is what I would encourage future public health leaders to focus on, so that we can get some new outcomes and better results for the populations that we serve.
Dr. Nicole Alexander Scott, you quite take my breath away. You started off doing 2 full-time jobs. You clearly do more than that now, but as a passionate leader, I'll bet you do them all better than anybody else ever has. Thank you so much for doing this with us.
Thank you for having me. It's important.